break. At 12:30 Eastern, lawmakers will break for their weekly party caucus lunches. They'll return at 2:15 Eastern for further debate. And now to live coverage of the U.S. Senate here on C-SPAN 2.
The Senate will come to order. The chaplain, Dr. Barry Black, will lead the Senate in prayer.
Let us pray. Creator God, who has nurtured us throughout the seasons of our sojourn, give to the members of this body the love, strength, and wisdom to do your will. Keep them from walking in the paths of unrighteousness, and let them feel your abiding presence in times of joy and sadness. Lord, empower them to hold fast to the good will that unites them, making them instruments of your purposes to bring peace in our days, peace to our souls, peace to our families, peace to our country, and peace among nations. May they be moved by your majesty and motivated by the magnitude of the responsibilities you have entrusted to them. We pray in your mighty name. Amen.
Please join me in reciting the Pledge of Allegiance to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The clerk will read a communication to the Senate.
Washington, D.C., July 31st, 2012. To the Senate. On the provisions of Rule 1, Paragraph 3 of the Standing Rules of the Senate, I hereby appoint the Honorable Christopher A. Coons, a senator from the state of Delaware, to perform the duties of the chair. Son Daniel K. Inouye, President pro tempore.
Mr. President.
Majority Leader.
I now move to, no, I'm sorry, I don't need to do that. We're already on S3414, which is cybersecurity bill. The time until 2:15 is for debate only. The time until 12:30 today will be equally divided between the two leaders or the designees. The majority will control the first hour and the Republicans the second hour. The Senate will recess from 12:30 to 2:15 for our weekly caucus meetings. Mr. President, I just alert everyone to this. I would hope those people led by Senators Lieberman and Senator Collins will work to come up with a finite list of amendments so that we can move on to the cybersecurity bill. I've spoken to the Republican leader yesterday, and I'm going to be really patient and try to get a list of amendments that we can agree on. I hope that that can be done soon. It's very important that we make a determination whether we're going to be able to get a bill. There's not a lot of time left to tread water, so to speak. This important piece of legislation, all one needs to do is look at what's going on in India today. Now, there's no cyber problems there that I'm aware of, but they've had one half of this country of India is without electricity today. Transportation has been shut down. Financial networks they have in India, which are significant, are down, and it's really a chaotic place. 600 million people in India are without electricity. And as we have been told time and time again, the most important issue we have facing this country today for security is cyber. We've been told that by the Joint Chiefs of Staff, by the head of the CIA. We've been told that by Democrats and Republicans. It's an issue that is important, and we've been told that it's something we can prevent. If we don't do this bill, it's not a question if there will be a cyber attack that will be really devastating to our country. It's only a question of when, and it can be stopped. And I would hope this Chamber of Commerce would get some sense. There was a big meeting they had with the Chamber yesterday. They were moving forward about what was bad about the bill. Problem is, they were dealing with the wrong bill. So I would hope that we can get something done on this. It's extremely important we do. There will be a Senators-only briefing today at 5 o'clock in the Visitor Center in the classified room. I'm told there are 2 bills at the desk due for a second reading.
Senator's correct. Clerk will read the titles of the bills for the second time.
S. 3457, a bill to require the Secretary of Veterans Affairs to establish a Veterans Job Corps and for other purposes. H.R. 4078, an act to provide that no agency may take any significant regulatory action until the unemployment rate is equal to or less than 6%.
I would object to both of these matters at this time.
The objection having been heard, the bills will be placed on the calendar.
Mr. President, I'm going to spend a few minutes talking about the Affordable Care Act. And I wonder how many people on the Republican side today are going to talk about Obamacare. If they do, they should be in a very, very positive state. We know that as a result of this bill, this Affordable Care Act, people are getting, and soon will get, everyone will get a rebate. One of the things we did, led by Senator Franken and others, is that 80% of the money that is paid for premiums has to go to patient care. And if it isn't, the amount that doesn't has to be refunded to the patients. And that's in the process now. In the month of August, all those monies will come back in a significant amount to Americans who have, in effect, have programs, they're part of programs that spend too much time on salaries for bosses. Also, we're going to talk a little bit today about what this does, this Affordable Care Act, for women in America today. As I said, I'm going to speak very briefly on this, but we're going to have people come today as soon as I finish, and as soon as the Republican leader finishes, to talk about the good things in this bill for women, and I'll just touch on them just very briefly. There's no question that this bill, signed by President Obama, is landmark. It's a landmark piece of legislation. It signaled an end to insurance company discrimination among many, but especially against those who are ill, against those with pre-existing conditions, and especially, Mr. President, against women. As a result of this bill we passed, being a woman is no longer a pre-existing disability in America. For many, many years, insurance companies have charged American women higher premiums. Why? Because they're women. And for years, American women have unfairly borne the burden of high costs of contraception as well. Even women with private insurance often wind up spending hundreds of dollars each year more for birth control. Today, women of reproductive age spend 2/3 more out of their own pockets for health care costs than men, largely due to the high cost of birth control. But starting tomorrow, Wednesday of this week, new insurance plans must cover contraception and many other preventive health services for women. How much, Mr. President? No additional pay at all. Under health reform, about 47 million women, including almost 400,000 women in Nevada, will have guaranteed access to those additional preventive services without cost sharing. Many on the other side have downplayed the importance of these benefits or fought to repeal them altogether. Hard to comprehend, but true. Forcing American women to continue struggling with the high price of contraception has very real consequences. Every year, millions of women in the United States put off doctor's visits because they can't afford the copays. And millions more skip pills or shots to save money. And it's no mystery why the United States has one of the highest rates of unintended pregnancies among industrialized nations. Half of all pregnancies in America are unplanned. And of those unintended pregnancies, about half wind up in abortion. Increasing access to contraception is the most effective way to reduce unintended pregnancies and to reduce the number of abortions. But the high cost is often a barrier. That's why, in 1997, Olympia Snowe and I began a bipartisan effort to prevent unintended pregnancies by expanding access to contraception. It hasn't been an easy path. It wasn't then, but we did make a start. As part of this effort, we helped pass a law ensuring federal employees access to contraception. I'm sorry about that, Mr. President. And it was a big, big issue. That was 15 years ago or more. It's an issue that is still important, but we started it, and I'm very happy about that. Olympia Snowe was terrific to work with. When this benefit took place in 1999, premiums did not go up a single dime because neither health care or did the health care cost, not a penny. It was rewarding to know that a pro-life Democrat and a pro-choice Republican were able to confront the issue with a practical eye rather than a political eye. It's unfortunate that over the last 15 years, an idea that started as a common ground proposal has become so polarizing here in Congress. The controversy is really quite strange when you consider that almost 99% of women have relied on contraception at some point in their lives, and many have struggled to afford it. Mr. President, 99%. The Affordable Care Act will ensure insurance companies treat women fairly and treat birth control like any other preventive service. Prior to Senator Snowe and I doing this, you know, Mr. President, anything that a man wanted, they got. Viagra? Fine, we'll take care of that. Anything a man wanted, they got, but not a woman. But the law doesn't just guarantee women's access to contraception. It assures our access to many other life-saving procedures as well. Thanks to the Health Care Bill, Affordable Care Act, insurance companies are already required to cover preventive care like mammograms. Mr. President, a person that is able to have a mammogram is life-saving. Most people in the Senate know that my wife is battling breast cancer. Mr. President, she had a mammogram in December and in August discovered a lump in her breast. And think what would have happened if she had waited a year because she couldn't afford that mammogram. Frankly, the thought of it is very hard for me to comprehend because even though she had that mammogram in December, she found she was in stage 3 of breast cancer, and it's been very difficult. But what if she'd waited an extra year? Many people wait a lot longer than an extra year. Colonoscopies. So I was talking to one of my friends in the Senate. You know, these colonoscopies save lives. He's going to have his done, and he'll do it every 5 years. It takes about 10 years for these polyps to develop cancer, but they all develop cancer if you don't take them out. People need to have these done. Blood pressure checks, childhood immunizations without cost sharing. That's part of what's in this bill. It used to be a bill, now it's a law. Starting tomorrow, again, Wednesday of this week, women will no longer have to reach into their pockets to pay for wellness checkups. They can do screening for diabetes, HPV testing, sexually transmitted infection counseling, HIV screening and counseling, breastfeeding support, or domestic violence screening and counseling. That's all in the law today, starting tomorrow. And all women in new insurance plans will have access to all forms of FDA-approved contraception without having to shell out more money on top of their premiums. Ending insurance company discrimination will help millions more women afford the care they need when they need it. And it will restore basic fairness to the health care system. Sometimes the practical thing to do is the right thing to do. And that's what the legislation that we work so hard to pass is all about. It's about doing the right thing for everyone. But today we're going to focus on women.
The Republican leader.
I might say to my friend, the majority leader, before he leaves the floor, I listened carefully to his speech about what most Americans refer to as Obamacare. I think, given the fact that our friends on the other side are going to focus on that bill this particular week, it might be a good idea to have a vote on it, on the pending bill. It would be my intent to offer an amendment that I know my friend does not support, but nevertheless many Americans would like to know here, since we have spent a good deal of time positioning over the last few months on various assorted issues, I think it would be appropriate to have a vote on the repeal of Obamacare, and I would hope to be able to offer that amendment during the pendency of the bill on cybersecurity, which we believe will be open to amendments. And I just wonder if my friend thinks that might be something both sides might agree would be a good idea.
Mr. President, I wonder if the court reporter can state the big smile on my face. Show that. I mean, can you imagine how ridiculous my friend, the Republican leader's statement is? Listen to what he said. We're doing cybersecurity. We've talked about the dangers of cybersecurity if we don't do something about it. And he's now telling me that he wants a vote to repeal all the stuff that I just talked about on cybersecurity? Mr. President, that is very difficult to comprehend. I think we should understand that I don't think a woman getting contraception has a thing to do with shutting down the power grids in America or the financial services in America or our water systems or our sewer systems. That's what cybersecurity is all about, not whether a woman can have contraception or whether she can have a wellness check to find out she's got cancer from not having had a mammogram.
Will the Majority Leader yield for
I would
question?
be happy to yield.
I'd like to ask the Majority Leader, do I remember that the very first amendment on the transportation bill was offered by Senator Blunt of Missouri on family planning? So is there a family planning amendment available on every bill now that will be offered by the Republican side? I know the House Republicans have had 33 votes to repeal Obamacare. Are we going to try to match them with similar efforts in the Senate?
My response, my friend, is this. I try to be very calm about things in life generally, especially things here on the floor, but I can't remain very calm about this. Mr. President, I have, as again a lot of people know, I have 16 grandchildren. They're evenly divided between boys and girls. I want my granddaughters to be treated so that if they want to go get have some contraceptive device or in school, New York University, Berkeley, I'm bragging about, they got in those schools, they should have the ability to do that. And I think that as I just can't imagine what we're talking about here on the Senate floor. Cybersecurity, one of the most important, it's the most important issue, as I've already said, dealing with, if you want to talk to General Petraeus, he'll tell you what it is. You want to talk to General Dempsey, he'll tell you what the important issue is. The number one issue today is whether we're going to have bad people attack our country and shut it down. And now we're here being asked if we're going to have a vote on cybersecurity as to whether my grandchildren can have contraception.
The Republican leader.
Mr. President, I guess the answer is no. My friends are going to spend the week lauding the advantages as they see it of an immensely unpopular bill that was passed a couple of years ago in a straight party line vote, Obamacare. Yet in a week in which apparently they're going to laud the various provisions of it, they're not willing to have a vote in support of it. So I gather that's a vote we will not have. I will request the opportunity to do that again. Anticipate listening to my good friend, the Majority Leader, such a request would likely be blocked. Now, on another matter, Mr. President, 4 years after the Great Recession, I believe I have the floor.
The Republican leader has the floor.
Okay, I won't answer the question later.
4 years after the Great Recession began, millions of Americans are still looking for work. Millions more have literally dropped out of the workforce altogether, and uncertainty about our nation's future continues to spread. The stories of disappointment and of loss haven't diminished. They have, in fact, multiplied. What's worse, a president who was elected on a pledge he'd turn all those things around is still pointing the finger at his predecessor. 3.5 years after he took office, he's acting like he just showed up. Well, look, Mr. President, I think most Americans are smart enough to know that he's made things worse. He's hammered small businesses with a barrage of new regulations, with dozens more in the pipeline. He expects them to plan for the future without even knowing what their tax and health care liabilities will be. Last week, he even spearheaded a legislative effort to take even more of what nearly 1 million of these small businesses earn, and then he told Republicans that if we don't go along with it, he'll raise taxes on everybody else. And that was the message last week. Either give me what I want, raise taxes on 1 million of our most successful small businesses, or we'll let everybody's taxes go up at the end of the week. In other words, he used small businesses as little more than a bargaining chip. The week before that, he told business owners they're not really responsible for what they've built. Listen to that. Business owners, the president said, you're not really responsible for what you built. No amount of White House spin or manufactured outrage can change what the president said in Roanoke. And no amount of finger-pointing can change the fact that his policies have actually made things worse. But what's most upsetting to a lot of us is the fact that the administration pretends its policies would help the economy or create jobs when it knows that they won't. It knows these policies are not going to create any jobs. What's most upsetting is the deception that lies at the heart of so many of the sales jobs, from health care to the stimulus. Americans wanted the president to focus on jobs, and he focused on a health care bill that we now learn not only includes a tax on the middle class, but which will lead to hundreds of thousands of fewer jobs. Now, the president claims he's fighting for the middle class, but 3.5 years into his presidency, their wages are still stagnant, while their dependency on government assistance actually continues to rise. Wages are stagnant, dependence on government assistance continues to rise. In some cases, the president doesn't even bother with the sales jobs. He just keeps his plans a secret. That's what we're now seeing with the defense cuts he's demanded during last year's budget negotiations. Literally for weeks, Republicans asked the president to tell the American people how he plans to carry out these cuts. He refused. Mr. President, the Senate's not in order.
The Senate will be in order. The Republican leader.
Yeah, as I was saying, for weeks, Republicans asked the president to tell the American people how he plans to carry out these cuts. He simply refused to do so. So last week, Congress passed legislation requiring him to do so. In fact, it cleared the Senate, I believe, unanimously. Then yesterday, there was this. An assistant secretary down at the Department of Labor is now telling people they're under no legal obligation to let employees know if they will lose their jobs as a result of these cuts. Let me say that again. We got an assistant secretary of labor just yesterday said that employers are under no legal obligation to tell their employees they may lose their jobs as a result of these cuts. In other words, the president's trying to keep those folks in the dark about whether they can expect to lose their jobs or not. Why? Well, I think it's pretty obvious. To insulate himself from the political fallout that will result. The president doesn't want people reading about pink slips in the weeks before his election. So the White House is telling people to keep the effects of these cuts a secret. Don't tell anybody, he says. Keep it a secret until, of course, after the election. Once again, a president who holds himself out as a great defender of the middle class and the goals of organized labor is putting his own political goals ahead of the hardworking Americans who will be affected by these policies. Rather than let those who will be affected by the cuts know about it, he'll make everybody nervous. For 3.5 years, 3.5 long years, this president has pushed an ideological agenda without regard for the consequences it would have on the very middle-class Americans he purports to defend. The President may not want to admit it, but the economic mess we're in is his legacy. His legacy. And after 3.5 years of finger-pointing, 3.5 years of finger-pointing, he owes it to the American people to be straight about it. Mr. President, I yield the floor.
The Senator from Maryland.
Mr. President, thank you. Mr. President, you know, every senator has to decide what they are going to do that day when they wake up in the morning. And for some in this chamber, they wake up every day thinking about how they're going to stop President Obama, how they're going to stop his agenda, and how they're going to do everything they can to stop him from having a second term. If you want to spend your time that way...
Could the Senator please suspend so I may announce the morning business? Clerk will report the pending business.
Calendar number 470, S3414, a bill to enhance the security and resiliency of the cyber and communications infrastructure of the United States.
So, Mr. President, there are those who wake up every day thinking about how they want to stop President Obama and stop his agenda. Well, you can wake up every day thinking about how you want to stop America from moving forward. That's not how I spend my day. I try to look at two things every day: the needs of my people, their day-to-day needs for a job, for an opportunity, for health care, and how that translates into national policy. And then I try to look at the long-range needs of our country. That's why I'm excited about being on the Intelligence Committee, where I'm working on protecting America from the attacks, the cyber attacks that are happening every day to our country, the stealing of identity, the stealing of trade secrets, and I want to move America forward. And I've worked very hard to do that. And one of the areas that I'm most proud of, that I've worked with the men and women in this chamber, many even across the side, both sides of the aisle, was on the whole area of women's health care. Many want to talk about repealing Obama health care. Well, I don't want to repeal it. They talk about replacing it. They never have an idea. So let me tell you one of the areas that we fought for. One of the things that we knew as we embarked upon the health care debate is that we wanted to save lives and we wanted to save money. And one of the areas that we wanted to do both was to look at how utilizing the new scientific breakthroughs in prevention, particularly early detection and screening, we could identify those diseases when early intervention will save that life and also save the money against escalating disease that ultimately costs more and can even cost a life. And nowhere was it more glaring than in the issue of women's health care. My hearings revealed that women were charged more for their health care than got less than men of equal age and health care status. We found that we had barriers to health care because everything about being a woman was treated as a pre-existing condition. If you had a C-section for the delivery of your baby, that was counted. In 8 states, they even counted domestic violence as a pre-existing condition. And then what we saw during this debate was the fact that they even wanted to take our mammograms away from us. Well, that was just a moment too far. So during the health care debate, while everybody was being a bean counter, I wanted American women knew that they could count on the Senate and the women and men of the Senate to stand up for them. So we came to the floor. We suited up. And we fought for a preventive health care amendment that not only passed, but goes into effect tomorrow on August 1st. And it will be a new day for women of all ages who will be able to get health care coverage for preventive health care at no additional cost, no co-pays, no deductibles, and no discrimination where they're charged more and get less. That's what Obamacare is. If you want to repeal that, then bring it on. We're ready to fight. We want to fight for that annual health care checkup that will involve mammograms, Pap testing, pelvic exams. We want to be able to do that screening for that dreaded C word around colon rectal cancer and lung cancer. We want to make sure that if you think that you're possibly a victim, a doctor suspects domestic violence, we can screen and counsel. We want women to be able to have that access, to be able to know early on what are those illnesses that they are facing. August 1st means that our long-fought battle will actually go into effect. And where does it go into effect? Well, it's already in effect in the federal law books. Now it will go into effect in doctors' offices. Women will have access to the health care that their doctor says they need, not what an insurance company says they need, or what some right-winger wants to take away from them. We're pretty mad about this. We were mad 2 years ago when they wanted to take our mammograms away from us, and we're going to be pretty mad if they try to take our health care away from us. But what we're happy about is that for over more than 50 million American women tomorrow, it'll be a new day. They'll be able to walk into their doctor's office and they'll say, "Good morning, can I help you?" And when they say, "We think you need it," when was the last time you had a mammogram? And they say, "Well, I never had one because I couldn't afford it." They say, "Oh, we can sign you right up for that." Tell me about your family history. Is it true that your father had colon cancer? Well, listen, we worry about that about you. Could be in a high risk. We're going to take a look at that and make sure you're okay. And for young women, we're going to make sure you have other kinds of counseling and services you need in order to have a productive family life. This is what this health care bill is all about. It's about people. It's about access. It's about preventing dreaded diseases. People will come to this floor and they'll pound their chest and complain about their president. We want to pound the table and make sure that women have gotten the health care they need. And also tomorrow, we're going to be very excited when we keep the doors of doctors' offices open to the women of America. Mr. President, I yield the floor.
Mr. President, first I'd like to thank you. First to my colleague from California for letting me go first ahead of her. I have a Finance Committee meeting. And second, to both my colleague from Maryland and my colleague from California, whose voices are so clear and clarion. I love to listen to the senator from Maryland. She speaks right to people. She has it. She gets it. And you know what? If we could get every American in a giant football stadium and they could listen to Senators Mikulski and Boxer on health care, 80% would be for it. And so I want to salute them and salute particularly Senator Mikulski for putting both the event earlier today and these speeches together. Now, I heard the minority leader speak. And it meant two things. First, it meant that the Republican Party doesn't want to do cybersecurity. It means that the greatest threat to our nation, probably even greater than terrorism, if you speak to some of our intelligence and military experts, will not be dealt with. Because we know what he's doing. He's asking for an unreasonable demand unrelated to cybersecurity to go on the floor, knowing that that will stop us from moving forward. It's a sad day. We have some of our colleagues from the other side of the aisle talking about we must not abandon defense. Well, one of the strongest things our defense of our nation needs is a strong cybersecurity bill. And because special interests, Chamber of Commerce and others don't want it, even though every military and intelligence leader has said how vital it is, it seems the other party, tea leaves show that the other party is going to block us from going forward. It's unfortunate and it's sad. And then second, the way he chose to block cybersecurity couldn't be worse in terms of substance and in terms of timing. Today, July 31st, the minority leader wants to put on the floor the repeal of so many things that are going to happen tomorrow to women and to men across America that benefits them. So his timing couldn't be worse. The very day before we're going to see huge benefits for the American people, he wants us to debate repeal. Why don't we let the American people see the good parts of health care before we repeal it, and we're not going to repeal it. So I want to talk about this day, or tomorrow actually, where so many portions of the Affordable Care Act go into effect. 3 million women in my home state of New York will benefit. From Buffalo to Montauk, in Albany and in Manhattan, 3 million women will receive free basic preventative care for themselves and their children. They will know so many women and men don't get preventative services because it's expensive to them. These services are free. But not only will they make those people healthier, the #1 goal, but they will reduce the costs of health care because every expert, Democrat, independent, Republican, moderate, liberal, conservative, says if you do more prevention, you're going to save money. And tomorrow, so many of those preventative services go into effect. More women will go in for annual preventative care visits to screen for cervical, ovarian, and breast cancer. More women will receive preconception and prenatal services so their children can grow up healthy, active, and strong. More women will have access to contraception and its additional health benefits like reduced risk of breast cancer, protection against osteoporosis. New mothers will have access to support and supplies for breastfeeding. More women will be screened for domestic sexual violence, sexually transmitted infections, and HIV. And to my colleagues on the other side of the aisle, when we say there's a war against women and they get their backs up, they want to repeal this and put nothing in its place. No preventative services, no access to contraception, none of the things I've mentioned. Yes, it is a war on women. Because if they really cared about women and they didn't like Obamacare, they would still have a proposal on the floor to keep these fine pieces of the legislation going forward so they're not cut off tomorrow, which is what they intend to do, but of course, thank God, will not happen. The change that we are making helps every woman who said, I would, but I can't afford it, it's just too expensive, finally get health care. Removing the copays is a great thing. Cutting the cost of preventative care is something that we long wish to do in America and can happen tomorrow. And what about all the other benefits that affect men and women alike? 2.5 million young adults who can stay on their parents' insurance. 5.2 seniors, men and women, in the donut hole who save $3.7 billion on prescription drugs. And what about the idea that when your insurance company charges you too much, of the money goes to profits and salaries and trips and advertising and not enough goes to health care? Starting tomorrow, you can get a rebate. We know our colleagues on the other side of the aisle, to them that's anathema to make insurance companies give people a rebate. So, bottom line, we want to move forward on a cybersecurity bill, and we regret that the leader is putting logs in its way, and even more importantly, we want benefits to millions of women and millions of men to go forward as was intended, as was voted for, as is the law of the land, and we will not let them deter us from bringing people those benefits. I yield the floor.
Mr. President,
The senator from California.
I want to thank the senator from New York for putting this into context for America. What has happened here this morning is, instead of celebrating with us, because tomorrow, August 1st, an entire list of preventive services for women go into effect because of Obamacare, yes, our health care law, the Republican leader says he wants to repeal all those benefits. Mr. President, not only does the Republican leader, in behalf of the Republican minority, want to repeal the benefits that go into effect tomorrow for women, he wants to repeal the entire health care bill. He wants to have an amendment to the cybersecurity bill, which is so critical to our national security. He wants to put an amendment on there to repeal a law that the United States Supreme Court found was constitutional and whose benefits are beginning to take hold in this country. Benefits that mean that right now people are receiving refund checks in the mail because their insurance company overcharged them, and under Obamacare, you can't do that. And hundreds of millions of dollars are going out to our people. The Republicans want to, I assume, force those people to send back their refunds because they want to repeal Obamacare. Look at the list of preventive health benefits that are already in effect because of the legislation. Let's move it. Already, because of health reform, and I see Senator Harkin here, who shepherded this through as our dear friend Ted Kennedy became sicker and sicker with brain cancer. And I'll never forget how Senator Harkin stepped up to the plate, Senator Dodd stepped up to the plate, Senator Mikulski stepped up to the plate, and they were the lieutenants who got it done. And the Republicans want to take it away. I can only imagine how Senator Harkin feels, having been in that fight. But I'm here to say I'm your supporter. I know what you did. And I know that my people in California, the largest state in the union, are getting breast cancer screenings now with no co-pays. They're getting cervical cancer screening, hepatitis A and B vaccines, measles and mumps vaccine, colorectal cancer screening, diabetes screening, cholesterol screening, blood pressure screening, obesity screening, tobacco cessation, autism screening. How important is that? In my state, they say there's an epidemic of autism. Hearing screening for newborns, sickle cell screening for newborns, fluoride supplements, tuberculosis testing for children, depression screening. How important is that? Osteoporosis screening. I watched as my mother just was in agony from osteoporosis. And there are things you can do now to avoid it, but you need the screening. You need to know whether those bones are losing that density. Flu vaccines for children and the elderly. And this list goes into effect tomorrow. So let's take a look at the list that goes into effect tomorrow that my Republican friends want to repeal today. Tomorrow, women will get access to all of these things without co-pays or co-insurance. Contraception, well woman visits, STD screening and counseling, breastfeeding support and supplies, domestic violence screening, gestational diabetes screening, HIV screening, and HPV testing. I am stunned that on the eve of the broadest increase in benefits in my lifetime, the Republicans want to repeal these benefits from women. This is a continuation on their part of the war on women. And they can get up and stand on their head and deny it and everything else. How else can you explain why on the eve of the day that the women are going to get all these benefits, they want to now cancel Obamacare and stop all this from happening? And if you think it doesn't matter, let me say to you, Mr. President, I know you know it matters whether women get free contraception, to cut back on unintended pregnancies and abortion, and well woman visits, and breastfeeding support, And how about domestic violence screening? So critical. Some women are in these terrible relationships and they go to the doctor and they say, well, I don't want to talk about it. Doctors will be taught how to spot domestic violence, and there can be an intervention that will save lives. So here we stand. We have this list of benefits, women's preventive health benefits, going to go into effect tomorrow. We are here to celebrate that. And instead of our Republican colleagues coming on the floor and joining us and saying how wonderful this is, and by the way, at the end of the day, this saves money. We all know that. We all know it saves money when you have screening and counseling for STDs and you head off an illness. We all know it saves money. And the health care bill saves money. And it reduces the deficit because of this investment in prevention. So I can't think of a more ridiculous situation than after a bill has become law for how many years now, Senator Harkin? Is it a couple of years that we passed it? 2 years? It went to the Supreme Court. It's upheld. And now, just as we're about to see these great benefits for women go into place, the Republican leader says, let's repeal Obamacare today. Let's have an amendment on the cybersecurity bill, he said, to repeal the entire health care law. Now, the House voted 33 times at least to repeal it. So I'm wondering, what is with this idea of repeal? Do you really want to take away these benefits from women, from children, from men, from families? Yeah, I guess you do. I guess you stand for going back to the old days when people could hear from their insurance company that they were cut off. When insurance companies could spend 70% on themselves and their own perks, and CEOs getting, hundreds of millions of dollars, and you, the patient, getting hardly anything. They want to go back. They want to take away the refunds. They want to take away the funding that our seniors are getting as they deal with the high cost of prescription drugs. And we fix that in this bill. So I have to say, we make an investment in prevention, in keeping people healthy. We make sure being a woman isn't a pre-existing condition. And the Republicans today have relaunched their war against women. They're holding up the Violence Against Women Act that we passed over here in a bipartisan way. They won't take up the Senate bill and pass it. Why? They want to take away coverage of that bill from 30 million Americans. They don't care about the immigrant population, obviously, the most vulnerable women there. They don't care about the college students, apparently, because we get extra protections for them on college campuses. We protect the LGBT community. Clearly, they're not interested in that. And they're not interested in protecting the Native American women. So while the Speaker says, oh, I will send conferees to a non-existent conference on a Violence Against Women Act, he could simply pass the bill and make sure that everyone is protected. And instead of celebrating today, because women are getting all these wonderful benefits without a copay, they want to repeal all these benefits. They want to repeal this law. And I could just say, truly, I don't know what motivates them. I do not speak for them. But if they say it's to save money, that's simply not true, because this bill saves money. This law saves money because we're investing in prevention. So the only thing that I can think of is they want to hurt this president. The Republican leader said his highest priority was making sure that President Obama is a one-term president. So I guess if it means attacking the health care law to hurt this president, he's willing to do it and hurt all my constituents who are getting these benefits and all of our constituents who are getting this benefit. Hurting the American people. Well, I say put politics aside. Let's see the Republicans come down here and celebrate the fact that finally our people are getting the health care they deserve and that they pay for. Thank you very much, and I yield the floor.
President.
The Senator from New Hampshire.
Mr. President, before I speak, I have 6 unanimous consent requests for committees to meet during today's session of the Senate. They have the approval of the majority and minority leaders, and I ask unanimous consent that these requests be agreed to and these requests be printed in the record.
Without objection.
Thank you, Mr. President. I am proud to join my colleagues on the floor today. Thank Senator Boxer and Senator Harkin for their leadership. Just as I was proud back in December of 2009 to join Senator Mikulski in sponsoring the Women's Health Amendment to the Affordable Care Act. We are here today celebrating the fact that tomorrow, August 1st, women will have access to important health services at no cost. And Senator Boxer showed very clearly what a number of those preventive services are. Thanks to the provisions of the Affordable Care Act that go into effect this week, women will have access to a wide range of preventive services from well woman and prenatal visits to gestational diabetes screenings, and they will have access to those services without co-payments or deductibles. So finances will no longer stand in the way of women getting the preventive health they need. This also has the potential to save our health system money in the long run. The Centers for Disease Control estimate that 75% of our health care spending is on people with chronic disease. So by taking these preventive measures, we can slow this growth and the associated cost of disease. Now, one of those preventive measures that I want to talk about this morning is screening for gestational diabetes. As co-chair of the Senate Diabetes Caucus, I understand the importance of gestational diabetes screening and the impact it can have on both the mother and the baby. Gestational diabetes affects almost 18% of all pregnancies in the United States, and unfortunately, the number of those cases is increasing. The consequences of gestational diabetes are real. Not only are there significant health effects for the mother and baby during pregnancy, but researchers have found that both the mother and baby may be at risk for developing type 2 diabetes later in life. By getting screened, both the mother and the child can be alerted to potential long-term health risks. I want to tell the story of one of my constituents, Megan from Pennacook, New Hampshire, because she's a great example of why this screening is so important. During her 28th week of pregnancy, Megan was diagnosed with gestational diabetes. The screening that she had alerted her to the potential related health issues, and they allowed her to get the necessary treatment. I'm happy to report that Megan gave birth to a healthy baby girl, Grace. She's now 8 weeks old. And under the Affordable Care Act, all pregnant women will now be able to receive the gestational diabetes screening for free. Tomorrow also marks an important milestone in women's health for another preventive service. Women, beginning tomorrow, will have access to contraception at no cost. Now, birth control is something that most women use, and it's something that the medical community believes is essential to the health of a woman and her family. For some 1.5 million women, birth control pills are not used for contraception, but for medical purposes, and they can reduce the risk of some cancers. With costs as high as $600 a year, birth control can be a serious economic concern for many women. Being able to now receive birth control for no cost will bring financial relief to so many of those women. And again, I have a story of a young woman from New Hampshire who I think illustrates so clearly why these are such important provisions. Carrie Wolf from Swansea, New Hampshire, is a full-time graduate student at Dartmouth. She's going to benefit from this provision because Carrie takes birth control as a medical necessity for treating a health issue that affects her adrenal glands. While Carrie's lucky to have insurance, she has to pay her plan's full deductible and then a monthly copay for her birth control. As a student who's trying to balance academic and living expenses, her prescription comes at a significant cost annually. When her new insurance plan goes into effect, Carrie's going to be able to get the full price of her birth control covered. That's great news in making sure that she gets the health care she needs. As governor of New Hampshire, I was proud to sign legislation that required insurance companies to provide contraception coverage to women with no religious exemptions. At that time, it was understood by people on both sides of the aisle, of all religious faiths, that requiring contraceptive coverage was about women's health and it was a basic health care decision. Yet over the last several months, opponents have continued to roll back contraceptive coverage at both the state and federal level. Every woman should be able to make her own health care decisions, and she should not have to have her boss stand in the way. The provisions that go into effect tomorrow ensure that women can make these decisions. I thank Senator Mikulski and Senator Harkin for their leadership in women's health, and I join them in celebrating these important provisions that are going to make a huge difference for women's health, that are going to be good for women, for families, and for everyone in this country. Thank you very much, Mr. President. I yield the floor.
The Senator from Iowa.
First of all, Mr. President, let me commend the Senator from New Hampshire for her great leadership as a governor and as a United States Senator in this whole area of health care for women, especially. She's provided great leadership in this area, continues to provide that leadership, and I just want to join with the Senator from New Hampshire in saying that we're not going to let these provisions that now are expanding coverage for so many women, 47 million women in America, we're not going to let these be rolled back. We're just not. Now, again, if the people of this country elect Mr. Romney to be president and they turn over the Senate to the Republicans, there it goes. It's gone. It's gone. I did not hear this morning, but I understand the Republican leader said this morning, I stand to be corrected, but as I understand, he said that they wanted the First Amendment that would be offered on the cybersecurity bill that I think is now before the Senate. He wanted the First Amendment to be a repeal of the Affordable Care Act. What timing? What timing, I say to the Republican leader, on the eve of when we are expanding preventative health care services for 47 million women in America. The Republican leader gets up and says, we want to vote to repeal this tomorrow. Tomorrow. Repeal it tomorrow. Does that kind of give you some idea of how they feel about the women of America and the health care of our mothers, our sisters, our daughters? That's what they want. We've already voted 33 times to repeal portions of the Health Care Act. I think we voted twice in the Senate already to repeal the whole thing. They want to have another vote. But I think it's just more than passing curious that the Republican leader wants to vote to repeal it on the very day when we're expanding health care coverage for the women of America. Interesting. Interesting. Tomorrow is an important day for American women. Thanks again to key provisions of the Affordable Care Act. And here I do want to commend Senator Mikulski for her great leadership in this area, Senator Dodd, Senator Bingaman, Senator Kennedy, when he became ill, asked us to take the leadership on different provisions of the Affordable Care Act in the Help Committee and to get it through. We had wonderful support from our colleagues here on the floor of the Senate and our committee, and these provisions that we put in to move us from a sick care system to a health care system. I've often said that in America we don't have a health care system, we have a sick care system. If you get sick, you'll get care one way or the other, usually in the emergency room if you're poor, or maybe not at all. if you don't make it to the emergency room. But there's very little in our country to keep you healthy in the first place. And yet we know, we have good data, that we know that preventative services up front saves you a lot of money and a lot of lives and a lot of pain and suffering later on. So in the Affordable Care Act, we put in a big provision on preventative services. And we said basically that what the Preventative Services Task Force of the Center for Disease Control and Prevention, what they listed as their A and B, those that had the, if I could use this term, best return on investment, or the biggest impact, that those would be free. There would be no co-pays, no deductibles. Senator Mikulski said, but you know, she reminded us of what is obvious but not too often taken into consideration in legislation, that is, women are different than men. And so we asked the Institute of Medicine to come up with provisions that apply to the preventative health care of women. That's what goes into effect tomorrow. Senator Boxer very eloquently talked about that and had the chart showing all of the different things that would start tomorrow and all new plans that would cover women in this country. And again, to keep women healthy in the first place, preventative services to keep women healthy without co-pays and without deductibles. And right on the eve of this, wonderful expansion of health care coverage, of making sure that women are not second-class citizens when it comes to prevention and wellness. On the very eve of saying to women that no longer can insurance companies sort of say because you're a woman, you have a pre-existing condition. On the very eve of that, the Republican leader gets up and says he wants to have the next vote on repealing the health care bill. Talk about a slap in the face to the women of this country. Well, I think women know what they're facing now, coming up this fall. I just point out that tomorrow, 519,000, actually about 520,000 women in Iowa will have expanded health care coverage, preventative services. We fought very hard to put these in the law, and we are not going to let them repeal it. We have the votes, let's face it, we have the votes here in the Senate to stop that. I mean, a Republican leader can bring it up again, and we voted on it before. But I think it's indicative of where they want to take this country. We can stop it now. But if Mr. Romney is elected president and he says on day one, he wants to repeal, when he's first sworn in, he'll send up legislation to repeal it. And if the Senate is in Republican hands and the House in Republican hands, you can kiss it goodbye. It's gone. We won't be able to stop it then. It's hard to believe, but prior to the Affordable Care Act, essential services that were unique to women, maternity care, for example, were not even often included in health plans. Tomorrow, we include free preventative checkups, well woman visits, free screening for gestational diabetes, and breastfeeding support and supplies. How many low-income women in this country would know that the best thing for their babies is breast milk? Breastfeeding, we know, is the preferred method of starting babies off. But sometimes these supplies can be expensive. And especially if they're working, and they're working at a low-wage job, they may need these supplies. But they can't afford it. So therefore they turn to other methods, to formula for their babies. I'm not saying formula is bad, but it's not, we know, doctors will tell you, every pediatrician will tell you that breastfeeding is the best. But women would be forced to choose a less best option if they didn't have these breastfeeding supports and supplies. And let me take on head on, if I can, a little bit this idea of, well, contraception. Well, as the senator from New Hampshire pointed out, this can be pretty expensive, up to $600 a year or more. Now, I suppose for one of us here making, what do we make now, $172,000 a year, and we got great health care coverage, that's not a big deal. But you take a low-income woman, got a couple of kids, working in a minimum wage job, trying to scrape by just enough to get by. Yeah, $600 a year is a lot of money. Let me point out another facet of this. And somehow people seem to have this idea that, for example, birth control pills are only to prevent a pregnancy. There are many young women of childbearing age in this country who take birth control pills on the advice of their doctor, not to avoid a pregnancy, but because their monthly cycles are so painful that they can't even work. And so what are we saying now? A young woman has to get a prescription from a doctor and says it's not for birth control methods, but it's for other physical problems. You have to take that in and show that to your employer now? You have to take that in and show it to your insurance carrier? Make women second-class citizens again. Nonsense. Nonsense. I respect religious freedom as much as anyone. But despite the Republican propaganda, this law does not mandate that any woman has to use contraception, and it does not force employers to dispense it. What it does is it gives women affordable access to birth control for a variety of reasons, should they or their doctor decide that it's right for themselves and their families. As for religious organizations that object to contraception, the President has issued a very sensible compromise to accommodate their beliefs while ensuring that women have access to this critical service. I respect, as I've said, the views of all people on these divisive issues. I would oppose any measure that threatens the fundamental religious liberties of individuals or institutions. But I say this very clearly. The Republicans on that side of the aisle are not motivated, I don't believe, by a genuine desire to protect religious liberty. Rather, they are determined to undo these and other benefits for women in the Affordable Care Act. They repeatedly introduced legislation approved by the House Appropriations Committee that allows anyone to opt out of providing any services to which they have a religious or moral objection. Well, you might say, well, that sounds reasonable on the face of it. But think about this. Any employer for any religious or moral objection could opt out of any coverage. Well, you could see them. They could say, well, not only contraception, but mammograms, prenatal screenings, all these other things. I just have a moral objection to that based upon my religious belief. I mean, I respect Christian Scientists. I've always respected them and their beliefs. But can they say then, well, then we're not going to cover insurance for an employee who goes to see a doctor for allopathic medical care because we don't believe in that. That's not our religious belief. In all these things, we have to have reasonable compromises, and I believe the President has come up with a reasonable compromise. So what the Republicans would do, according to their leader this morning, they would rob 47 million women of these new preventative services. 47 million. And they would rob 1.1 million young women of the insurance they've already gained through the Affordable Care Act's extension of dependent coverage. America's women are not going to be dragged backward. They're not going to allow health insurance companies to return to the policies and abuses that hurt them and their families prior to the passage of the Affordable Care Act. Tomorrow marks another step forward in transforming our current sick care system into a true health care system. And many women will now experience this firsthand. So we are going forward. The Republicans can bring it up time and time and time again. They have sent a very clear signal to the women of America. Whatever you've gained, under the Affordable Care Act. All these benefits, we're going to take them away from you if you put us in office. I think the women of America need to have some really deep soul searching about who they want deciding their fate in the future after this next election. Mr. President, I yield the floor.
President from Illinois, Senator from Illinois.
Mr. President, first let me thank my colleague from Iowa, Senator Harkin, for